Okay, so we're going to talk about BVM ventilations, which is another really key part of the ABC basic life support skill set. What we have in front of us here are BVM, so bag valve masks is what they're called. We also have our suction out because we're going to have that handy at all times when we're working with the patient's airway. So we have a selection of mask sizes here. We have a selection of BVM. So we have an adult, we have a child, and we have an infant BVM. All right, so the first step is to size the mask. So what I'm going to do is I'm going to select an adult mask, with this being an adult patient, and I'm going to make sure that the mask covers the patient's mouth and nose properly. So from the bottom of the chin to just in between the eyes. That's the first step. The next step is to select the adult BVM, attach the mask to that BVM, okay, and to test that there's a good seal on that BVM. I'm going to place the mask over the patient's face and use what's called a C to E hold. So I'm making a C with my hands here to support the mask, and I'm making an E with my hands here to pull the jaw up into the mask, and that's how I make my seal. So I make sure I have a good C to E grip, and I'm going to ventilate, making sure that when I give the ventilations, the chest is going to rise each time. So what I'm doing is I'm delivering approximately 500 milliliters or so to an adult patient. The actual correct rate is 6 to 8 millimeters per kilogram. I'm making sure I feel good compliance as I do ventilate, and I'm looking for bilateral chest rise. I'm going to deliver approximately 12 to 20 ventilations every minute for an adult. Sometimes with the BVM ventilation, it's tough to maintain a good seal, so another option is to get a partner to come in and use another set of hands. So I'm just going to ask my partner here to do the bag part, and I'm going to just maintain the seal that I have. And that way, it keeps their hands free.